Feelings of depression are common during the perinatal period. However, mental health stigma may prohibit people from seeking the help they need. In this study, we explored how likely mothers and perinatal persons would be to seek help for depression from different sources by level of perinatal depression stigma. We recruited 284 perinatal persons and mothers from the United States and Canada online who follow MomWell, a mom-centered community that empowers and supports maternal wellness by sharing psychoeducational content about maternal mental health via their social media accounts, podcasts, and blog. We asked participants to identify how likely they would be to seek help from several different sources if they were experiencing symptoms of depression. Participants completed the mental health literacy scale, which asked them to rate how much they agree with different statements about perinatal depression stigma. We grouped mothers into higher versus low perinatal stigma based on higher or lower scores of agreement with depressive stigma statements. We compared how likely mothers with higher versus low levels of perinatal depression stigma were to seek help from different sources using Mann-Whitney-U tests. 9% of mothers reported higher levels of perinatal depression stigma. Perinatal people and mothers with higher perinatal depression stigma were more likely to seek help from phone helplines, religious leaders and communities, social media, and the MomWell community. They were also less likely to seek help from their spouse or partner or a mental health professional. However, we found no differences in the likelihood to seek help from friends, family, or doctors by level of perinatal depression stigma. Perinatal depression stigma may influence if and from whom perinatal persons and mothers seek help. Disseminating content focused on decreasing stigma about mental health on social media and other digital platforms may help improve willingness to seek help, such as informal support from partners and care from mental health professionals.